Namaskar. I'm Kumar Rakesh. You are watching Global Governance News TV. Today, going to discuss the achievements of 100 days, achievements of the Modi government 3.0. And we'll discuss today the performance of Union Health Ministry, Health and Family Welfare Ministry, headed by Mr. JP Nadda, who also happens to be the BJP national president. Already 3 years spent, and now he is in triple charge as the BJP president and the Union Minister of Health and Family Welfare and Union Minister of Chemical and Fertilizer with two MOS. Pratap Rao Jadhav, he is independent MOS of Ayush Ministry, but as well as MOS in the Health and Family Welfare, and other Anupriya Patel. So today, he addressed the press conference, and I will just talk about the achievements and uh, how he has highlighted his achievements. Just time to watch and see, we can understand. So I'm discussing. I'm going to discuss the all highlights and points about the health ministry. And then, with our guest, we'll discuss about the special comment from the Poonam Sharma, our political analyst. Poonam, we welcome in this program. So I'm just going to discuss about the uh, all the health ministry achievements, 100 days, and highlights are the uh, two or three points we're going to discuss. And as Union Health Minister noted, the around rupees 15 lakh crore of investment has been made in the last 100 days with speed and scale across the different ministries. So we can understand how it is developed. He noted the Ministry of Health and Family Welfare has launched several key initiatives aimed at enhancing the healthcare delivery and access in Bharat. And some schemes, just one scheme is Ayushman Bharat, as I told you, PMIAY, uh, PAJAY. Scheme to include all senior citizens, irrespective of income group, age 70 years and above, with a potentially benefit around the 6 crore individual across 4.5 crore families, and highlighting the Ayushman Bharat, the world's largest publicly funded health coverage program. And Mr. Nadda informed that the expanded scheme will be implemented from October 2024 this year. And another scheme is the You Win, and then the TB, I got the TB treatment and the department of the deployment of the Visp cubes already given to the Ukraine recently in the Prime Minister visit. Use of drone services to just for pickup and delivery of medicine. Very innovative scheme. And medical education seats increased but not satisfactory, and increase the PG and UG seats. And this is new innovative idea of the operationalization of National Medical Register (NMR), first time for the all allopathic registered doctor in India. They're going to roll and they to find how many doctors, which states and which districts, and we can find anywhere just for the public utility factor. And national quality assurance standard for the public health laboratories and establishment aims mostly in Bihar and super especially blocks in the about four medical college in Bihar, and whatever he has uh, tried to focus, and also food import rejection alerts, online portal designed to notify the public and relevant food safety authorities about the food import rejections at the Bharatiya borders, and training of the food street vendors by FSSI how you should be hygienic food, as we have been just seeing the pics and photos from the different one how they are using the some the urine, some the I think liquid, some the acid, and some the spitting. So this is the most important to train the food street vendors because they have also right to live. So one by one, we'll discuss the program accordingly. And as I told you, the National Medical Register is a comprehensive dynamic database for allopathic doctors, registered doctors in Bharat, NMR is a link with the Aadhaar ID of doctors that ensure that individual authenticity also. And Mr. Nadda said NMR being a key component of the country's Ayushman Bharat digital mission, it will be part of the Healthcare Professional Registry (HPR). He further said NMR will be ensure provision of data covering details of around 13 lakhs doctors in country, state-wise, those who have left the country, those who have lost their license to practice, and details of doctors who have lost their lives also. This is a good one, the very new innovative scheme of the. Before that, I have not heard this type of scheme or register, and the National Virtual National Quality Assurance Standard assessment of the Ayushman Arog Mandir sub-centers set of standard designed to ensure and improve the quality of health services in the district hospitals, community health centers, Ayushman Arog Mandir Primary Health Center, Ayushman Arog Mandir Urban Primary Health Center, and Ayushman Arog Mandir Sub Health Center. And also, Nadda said August 31st, 2024, 13,082 public health facilities are NQAS certified, National Quality Air Certificate, and total of 5,784 public health facilities have been NQAS certified from April 1, 2024 till date, in which 3,134 facilities, including 2,074 Ayushman Arog Mandir sub-centers, had been certified by all levels 100 days. And this is a very good one initiative. And the establishment aims in the Darbhanga, also Indian cabinet approved and planned already 150.13 acres of land on August 12, 2024 required for AIMS Darbhanga. He further noted the AIMS institution would serve the fill the gap in affordable tertiary health care services, reduce out the pocket expenditure, and super specialty block also for the four medical government colleges in the Jawaharlal Nehru Medical College Bhagalpur, Anurag Medical College Gaya, Sri Krishna Medical College Muzaffarpur, and Darbhanga Medical College and Hospital. And also the super specialty block and launch. And before that, I'm talking the medical education, but whatever they have increased the seat about 64,464, 125% seat increased in the MBBS from 2013 to 14. And in 2013-14 there was a 51,348 seats, and now is 1 lakh 15,812 seats. So an increase of 64,000, but it is I think three times should be increased for the list exam and the entry for the doctors and with of doctors, and PG seats also not satisfactory. I'll not tell you. I'll take comment the Poonamji. 5.92% in PG seats. There were 69,024 seats in 2024 to 73,111 in 2024-25. The last 10 years, number of PG seats increased only 39,460. They're claiming the 127% from 13-14. There was only 31,185 seats. Now 73,111 seats. So this is all the, and the drone service, as I told you, the very is a rapid, cost effective, and safe delivery of medical supplies and samples in hard to reach and tough terrains. I think the hilly area is very useful. 15 M's INIs any institution have been identified for drone services. Drone trials and training has been completed in 12 institutes. Mr. Nadda said that drone provide a safe, accurate, reliable pickup and delivery of medicines, vaccines, and blood diagnostic specimens and other life-saving items to difficult to reach facilities. So these are all the highlights as I discussed you. So Poonamji, how just you comment and which policy you like most and what is new one and how just rating the Union Health Ministry with your work.
Namaskar. As we have seen the new schemes and in 100 days the approach that has been taken by the government, it is very welcoming, but there are many challenges also. You asked about the scheme which is liked. Yes, the drone facilities which shall be available for the delivery of the medicines to the hilly areas and the remote areas. That is a very,
Little
very,
loud, please.
yeah, the drone facility that will be available for the remote areas, that is a very welcoming. This has never happened, in fact. So this is because it is, it will be creating jobs also, and as well as, but here I would like to add something that yes, the challenges which may face, the minister, he did not talk about how to cope up with the black marketing. Actually, the black marketing of the medicines, this is a very big challenge in our health sector. In fact, we have been very much doing very well. India has been doing very well since in the days of corona, and also it has been a
Yeah.
very great manufacturer of the life saving drugs and every medicines, and also the costs are
And
also
also,
being.
I'll take the more comment on the all different schemes and whatever 15 lakhs crore investment from different health sector. I'll check your comment. Just stay with us. The time of the break. After break, we'll come again. Welcome back. We're discussing the performance of Union Health Ministry under the Modi government 3.0, and how just they have performed, how the performance is going on. All the ministry has been already every day they are going to display and discussing the achievements in the 100 days edge about the Prime Minister by Modi already sketched and drafted before election result. This was we can say this is the great confidence of the Modi ji when third time he make the history after Nehru. How they are similar, that is the different question, but Mr. Modi is far, far, far better than Mr. Nehru, what they have performed and what Mr. Modi is performing now. So there's a scheme, Poonamji, and just a WISP cubes, very rapidly deployable modular medical facility, and for emergency lifestyle clinical care in event of the disaster, public health emergency are very significant. Bharat has gifted four WISP cubes to Ukraine during the Prime Minister visit to the country recently. How do you analyze?
Yes, if we talk about the foreign relations, so we have got a very good. Modi ji had developed a very good strategic foreign relations also. So in this, the inter-exchange of these communication is very, effective, and we had been doing it with many countries also. This will, in diplomatic way also, we have been doing will great improvement in our relations also. So because
But
he had
there is a
visited
question,
Russia.
Poonam. There is a big question to you. And I have been just last 20, 25 years, as more than 30 years, I have covered all the governance and the government ministry in the union ministry. So I can give you input. But there is a scheme. I have been just watching and viewing the National TV Elimination Program, NTEP. But till date, government has not able to declare that our country is TV free, and only they are just claiming reducing the treatment duration of 9 to 12 months to 6 months, and it is along the health technology assessment by ICMR. Do you think it is just commendable? I think there is so many research in the field of TV
This
diagnostic
is
and all.
this is a challenge actually. We still need researchers, and because our health sector is growing actually, and we are challenged with growing population. Therefore, and also these 10 years, in fact, I would say Bharat has done a commendable progress in health sector, and yes, more researchers are to be, carried out for in various because in for controlling communicable and non-communicable diseases, we have achieved we have
So, but there is difference.
major
But communication
achievements,
of toll. By the
whether
more than
it be
30 years, scheme is going on.
eradication of
But what about
smallpox
doctors
or
and the scientists and researchers are doing?
yes, I
And
think
lots of money,
yes.
lots of money, all already pumped.
No, no,
Lots of
no,
money
no,
already
no.
pumped in this scheme,
No, no,
but
yeah,
still no
that
result.
is true. That is true. But you see, first of all, there you will also agree that we have been suffering with corruption is such a factor that
Corruption is that you should
retards
you are going to the
retards
innovative in so many
and
ways, and just doing
and
the good program, the universal immunization program, and the our portal is going on, and but
and
giving treatment like that, and the malaria and TB is not eliminated. So
and
really, the global
not
service
only
very
that,
very
good,
innovative, huge, very innovative sectors.
we
Whatever
need
medical education also
doctors.
not increase the seats, and the 40 crore population, you are peanuts is like that. Only the 50,000 seats or 39,000 seats. You are just claiming this. You have done the big way. Do you think so?
We do need more doctors, and the problem is here is the educated means after being educated, after having holding degrees, the brain drain is also a responsible factor for that. I do consider it like that. I do see it like that. So it is very important, to first of all, to for the corruption, for the black marketing, for these what government is doing, or what the government is taking measures for the, so that has to be very much clear actually. So that has to be taken care of. And in health sector, in fact, whatever is my assessment, in fact we are doing well. But yes, there are challenges, there are, so in future I think the government, these are only 100 days they have
Okay,
announced
just
schemes. In
okay. So we'll
future they
see the
will,
how this actually
yes,
already they read the papers like that. We have done this, we have done this, but nobody is asking the question. Our media is just sleeping like anything. This is
the
not ways of this
enforcement
is
is
one
very
way
much
system.
important. Let's see.
So
Right.
so nice of you. Just you commented on the all the points, all whatever they have announced. I will go at the other ministry also, and I will discuss all the performance of the Modi 3O government, inclusive the all ministry one by one. Thank you very much. Jai Hind, Jai Bharat.